Let's talk about ulcers, specifically peptic ulcers. Peptic ulcers are basically these open wounds that can develop in the stomach, and it can cause a lot of pain and discomfort. Now, what causes it? There are two things that generally cause it. Of course, there are other things as well, but these are what the main majority of patients with this condition, this is what causes it. Number one, H. pylori, also known as Helicobacter pylori. This is a bacteria, which is why many cases of ulcers are treated with antibiotics. The second thing that can cause this is the overuse of non-steroidal anti-inflammatory drugs like ibuprofen or Aleve. So depending on what caused it in your case, that's what needs to be focused on when trying to fix the problem. So let's talk about that. What can heal up the lining, the gastric lining, and the ulcers, and what can actually get rid of the bacteria as well. So number one on this list is licorice root, specifically DGL, D-glycosinated licorice root. The reason why is regular licorice root, it's not generally a problem for majority of people, but if you take it in that form, in really large quantities, it can increase your blood pressure. Or if the patient is already hypertensive, it can, even in smaller quantities, increase blood pressure. So you just got to be careful with that. But for majority of people, it doesn't do that. However, a lot of misinformation or misinterpreted information has gone around and people are terrified of licorice root. So DGL is the safer form, keeps everybody calm, and it works as well. And so DGL is, like I said, it stands for D-glycosinated licorice root. It heals up the gastric lining. It creates a protective layer on top of the stomach lining, and that helps to allow for the healing to occur. Also, it has anti-secretory properties, so it can work as an antacid as well. So DGL is number one on the list. Number two is mastic gum. Now, mastic gum is getting quite popular these days. It's actually a really old medicine. It's been used in Ayurvedic medicine for thousands of years. Highly beneficial for gastrointestinal problems, specifically H. pylori. In clinical trials, it's actually been able to eradicate this bacteria quite efficiently. So H. pylori can be cleared out with this. Overall gastric function usually improves when you get rid of this bacteria because it can cause a lot of problems for people. So mastic gum is the second option. Third on this list is vitamin U. Now, you may not have heard of this before, but vitamin U, it's technically it's not a vitamin, but I mean the classification is understandable. Its chemical name is methylmethine. It's a derivative of the amino acid known as methionine. And methionine is used for healing the body. It's used for angiogenesis, the formation of new blood vessels. And so what methylmethine does in its raw form from its source, which is actually cabbage juice, which sounds a lot worse than it actually is. I've tried it myself. It's not that bad. And I hate juicing. And I hate even blending things, but this one actually wasn't that bad. So what this is able to do is within 2 weeks, it's able to heal up ulcers, most ulcers. And it's been proven in, I think it was 2 clinical trials that were done on this. I'm going to post the studies in the description of this video. And it was found to be quite beneficial in healing up ulcers. So these are 3 things that can help you. Number 1, licorice root, specifically DGL, mastic gum, and vitamin U from cabbage juice. Don't go out and look for vitamin U supplements. It's better to get it from the source, which is cabbage juice. If you're into that kind of thing, it can work for you. A lot of people are against it just based on the sound, but luckily a lot of the people who come to me, they're into juicing, at least some of them are. And at least I don't recommend it as a lifestyle thing, but a lot of people do it. And so I've had a lot of people try it out, and they've all, well, with the exception of one person, that's because she was doing other things as well and combining and mixing medicines, which she shouldn't have been doing. But the people who did it the way they were supposed to, with proper supervision, they all had beneficial results in my experience. So I strongly suggest trying this out. So yeah, that's my take on ulcers. I hope this information has helped you. If you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations, so no matter where you are in the world, you can get in touch with me and we can talk. I'll see you in the next video.